Hello everyone, and welcome to our first session of our Medicare series, Medicare Basics. Medicare was established by the federal government in 1965 as part of the Social Security Act of 1965. Medicare provides health insurance for people 65 or older, as well as people with a disability receiving Social Security disability insurance after 2 years of receiving the benefit. People diagnosed with end-stage renal disease at any age, and people with amyotrophic lateral sclerosis, also called Lou Gehrig's disease. Medicare covers most healthcare services and items, but not all healthcare services are covered under Medicare. Eligibility for Medicare is not determined or based on income. People who are receiving Social Security retirement will be auto-enrolled in Medicare when they turn 65. People who are not receiving Social Security retirement at 65 will need to actively enroll in Medicare Parts A and B through the Social Security Administration. Original Medicare is administered by the federal government. Original Medicare includes Part A, hospital insurance, and Part B, medical insurance. Original Medicare pays for 80% of costs for covered services, and the individual is responsible for 20% of the cost. Part A covers inpatient hospital stays, inpatient care in a skilled nursing facility, not custodial or long-term care, hospice care, and some home health care. Part B covers doctor and healthcare provider visits, outpatient hospital care, and some home health care, not custodial or long-term care. Part B also covers durable medical equipment such as wheelchairs, walkers, hospital beds, etc. Preventive services are also covered under Medicare Part B. It is important to understand what the cost or responsibility is for Medicare Parts A and B. Medicare Part A is usually premium-free for people who have worked 40 quarters, 10 years or more, and paid into Medicare taxes throughout this time. For people who do not qualify for premium-free Part A, premiums vary. A person who has worked between 30 to 39 quarters has a standard Part A premium of $285 a month in 2025. A person who has worked less than 30 quarters has a standard premium of $518 a month in 2025. Medicare Part A has a deductible of $1,676 per benefit period for 2025. A benefit period begins the day a person is admitted as an inpatient in a hospital or skilled nursing facility. The benefit period ends when they haven't gotten any inpatient hospital care or skilled nursing care in a skilled nursing facility for 60 days in a row. The benefit period is not dependent of the calendar year, and there is no limit to the number of benefit periods. People usually are responsible for paying a premium monthly for Medicare Part B. The Part B premium is usually directly taken out of their Social Security benefit. The base monthly premium for Part B is $185 in 2025. Some people may have to pay more for their Part B premium depending upon income. Medicare Part B deductible is $257 per year in 2025. After enrolling in Medicare Parts A and B, it is important to understand that there are additional coverage options available, such as standalone prescription drug coverage, Medicare Advantage plans, or supplemental coverage, also called Medigap plans. Prescription drug coverage, also called Medicare Part D, is an optional federal government prescription drug program that covers prescription drug needs. People are able to choose their prescription drug coverage from a Medicare-approved private insurance carrier. Monthly premiums are paid to the private insurance company. Plan costs vary depending on the plan chosen. Average base premium for prescription drug coverage is $36.78 in 2025. The standard deductible for prescription drug coverage is $590 in 2025. It is important to note that although prescription drug coverage is optional, if people choose not to obtain prescription drug coverage when they are eligible to enroll, they could experience a gap in coverage and possible late enrollment penalties. Medicare Advantage plans, also called Medicare Part C, are benefits provided through Medicare-approved private insurance carriers. Medicare Advantage plan premiums are paid monthly to the private insurance carrier. Medicare Advantage plans bundle and cover inpatient hospital Part A and outpatient services Part B. Most plans also include prescription drug coverage as well. People must have both Medicare Parts A and B to be eligible. Medicare Advantage plans offer additional benefits such as dental, vision, hearing, etc. These additional benefits are limited. The cost of the plans depends on the plan chosen. Medicare Advantage plans require monthly premiums, deductibles, co-payments, or co-insurance. Premiums for these plans are generally low or no cost. Doctors need to be in network to get the best deal. Medigap plans are benefits provided through Medicare-approved private insurance carriers. Medigap plans cover remaining healthcare costs for covered services not paid for by original Medicare, such as deductibles, co-payments, and co-insurance. People must have both Medicare Parts A and B to be eligible to enroll in Medigap plans. Medigap plans do not cover prescription drugs or any additional benefits. Costs of the plans depend on the plan chosen. Premiums are more expensive. Plans are accepted anywhere in the United States that accepts Medicare. When people become eligible for Medicare, it is important to understand their options. There are two main ways to get Medicare: Original Medicare or Medicare Advantage. There are certain times of the year where people are able to change their Medicare coverage if they choose. Medicare open enrollment, also known as the annual election period, is one time every year people who have Medicare insurance can shop around for new insurance for the following year. Medicare open enrollment is from October 15th through December 7th each year. The change in Medicare insurance will occur on January 1st of the following year. There are also other times, such as Medicare Advantage Plan open enrollment. This is from January 1st through March 31st of each year, and the change would take place the first day of the following month from when the enrollment occurred. So, to recap, Original Medicare includes Part A, hospital insurance, and Part B, medical insurance. People are able to add drug coverage by joining a standalone Medicare prescription drug plan, Part D. When enrolled in Original Medicare, people can use any doctor or hospital that accepts Medicare anywhere in the United States. People also have the choice to add supplemental coverage to their Original Medicare, such as Medigap, former employer insurance, union insurance, Medicaid, etc. Medicare Advantage plans are an all-in-one alternative to Original Medicare. Medicare Advantage plans include Part A, Part B, and usually Part D. Medicare Advantage plans may have lower out-of-pocket costs. People enrolled in a Medicare Advantage plan will need to use doctors who are in their plan's network. Most plans offer extra benefits such as vision, dental, and hearing. We at Jefferson County Office for the Aging are available to assist people with understanding Medicare and the process of enrolling, options available, narrowing down options, and assisting with the enrollment process for additional Medicare coverage. That completes our session today. We hope that this helps you to better understand Medicare and a bit about the benefits offered and how we can assist you. Please be in touch with us at the office if you have any questions or are in need of assistance. We are happy to help. Stay tuned for more Medicare information sessions to come.